I want to give you a little bit of a heads up of what we're going to do. We have a handful of speakers for you. Franklin County Board of Commissioners President John O'Grady, Mayor Andrew Gensler, Columbus Public Health Commissioner Mashika Roberts, Dr. Robert Falcone from the Central Ohio Trauma System, and Brian Jepson, who's the administrator of the alternate care site. All of our speakers are going to speak first, and then we have a handful of other people on the phone to answer questions. I'll go through the hand raising technology if you need that before we get started on questions. So Commissioner O'Grady.
Well, good morning. Thank you all for being here. I know this virtual press conference is a little bit awkward, but it's the responsible way for us to do this. So thanks for all of you for playing along. We're excited to tell you about this overflow hospital facility and its capabilities. And you're going to get a chance to hear from some of the folks who've made all of this possible. But first, I want to start with a few acknowledgments and thank yous. Beginning with my colleagues, Marilyn Brown and Kevin Boyce. I couldn't be prouder of the way that everybody has responded to this crisis. We couldn't have a better team to work with here. We funded this alternative care site because the residents of Franklin County are our responsibility, and we're always going to do whatever it takes to make sure that they've got the care that they need. I also want to thank Don Brown and the CFA board for jumping into action and being willing to transform your facility into a hospital on the fly. Lastly, I want to acknowledge the National Guard, the Central Ohio Trauma System, and Franklin County EMA. These are the folks with the plans, the know-how, and the manpower that it takes to make something like this possible. We're really fortunate in our community to have people like these that are looking out for us. We're also fortunate to have such a great number of sophisticated large hospital systems such as Ohio State, Ohio Health, and Mount Carmel. And even more remarkable, we're fortunate that they were willing and able to collaborate and make this thing happen. As we've learned more and more about COVID-19, it's been scary to see the projections for how many people could end up being sickened or die from it. Mr. Rogers had that famous quote, though, about looking for helpers in scary times. Well, we've got a community full of helpers right here. When it became clear that we should make plans for an overflow surge facility, nobody balked or looked for a way to make a buck from it. Nobody tried to put it off or to claim the attention for it for themselves. Every one of our elected partners, at the folks at the convention center, and from the three major hospital systems to the National Guard, all just jumped into action and asked how they could help. This facility represents a $5 million investment by the county commissioners in our community's good health and bright future. But it also represents the way that strong communities work together to take care of each other. Some people will say that that's another example of the famous Columbus way. Well, they're right. But I just call it the right thing to do. I got a chance yesterday to take a tour of the facility, and I was most impressed with how so many people pulled together to make it happen. I don't know if it will ever need it, but the best thing would be if we never have to open this facility up. But if we do, it's a comfort and a tribute to the entire community that we've been able to put it together in the first place. Thank you again for all of you today for being here. And I'm very, very proud to introduce my good friend, Mayor Andrew Gensler.
Thank you, President O'Grady, and thank you for the county's ongoing commitment and partnership as we face this crisis. I want to acknowledge and thank our Health Commissioner, Dr. Mashika Roberts, Dr. Robert Falcone, who's CEO of the Central Ohio Trauma System, Brian Jepson, the president of Ohio Health, the Central Ohio Market. There are others that are joining us here today that will be able to answer questions during Q&A. And I want to thank Jeff Young from Franklin County EMA, Don Brown from the Franklin County Convention Facilities Authority, Joe Mazzella, our leader of Franklin County Public Health, City Council member Priscilla Tyson, Lieutenant Colonel Buchanan with the National Guard, Jeff Klingler, Central Ohio Hospital Council, Sherry Kovac, with Central Ohio Trauma System, and Malcolm Porter with the Central Ohio Trauma System. Thank you all for joining us and for all of your incredible partnership. It's hard to remember. 6 weeks ago seems like months upon months at this point. But where we were as a community when we had to make a very difficult decision regarding one of the biggest weekends of the year here in Columbus. And the governor and I were very lucky to have public health experts informing the very tough decisions we had to make. And so grateful for Dr. Amy Atkin and Dr. Mashika Roberts. That time we had no confirmed cases in Ohio. We understood the huge economic impact to the region. Every hotel room in Franklin County is generally booked the weekend of the Arnold Expo, and a $53 million economic impact. But we were fortunate to be able to have Dr. Roberts and Dr. Atkins see things that we had not yet seen and could share with us the impact on spread and the virus had we proceeded on. And so I'm grateful for them. 2 weeks ago, Governor DeWine and Dr. Amy Acton asked Ohio regions to find suitable places for potential overflow care for residents suffering COVID-19. Today, we've turned the convention center into an alternative care center should our hospital systems need the additional space. Again, we listen to our medical experts and public health leaders. Like President O'Grady was able to tour the site separately yesterday to make sure we were practicing appropriate social distancing and not having larger groups together. And what I was struck by and reminded of is how very fortunate we are to have Joe Mazzola, Dr. Mashika Roberts, coordinating with our health systems to make sure that we are fully prepared to make sure that our residents have access to quality care during this crisis. The collaboration that has taken place has been exceptional. Generally, we have hospital systems that are in fierce competition with one another, but they have always known that by working together, by collaborating and putting public health and safety and health of our residents first, that they could do something unprecedented. And quite honestly, and they'll probably speak to this later on, the leaders of those health systems, their medical directors, are getting calls from their colleagues from around the country who are trying to figure out how we have done this so quickly and in such an effective way and an efficient way. And without the leadership of our health systems, we simply would not be here today. Our National Guard and, again, the city, county, and state public health leaders. As President O'Grady mentioned, there are many different things that we're proud of when we talk about public-private partnerships, collaboration, and the common good. This is another great example of the Columbus way, or as he said, doing the right thing and putting the people of Central Ohio first. In the last week, we've received encouraging numbers from the Ohio Department of Health. The stay-at-home order and social distancing have dramatically reduced the number of expected cases in Ohio, something that we can be very proud of, but something we have to rededicate ourselves to as we face a crisis unlike we have ever seen. If we stay the course, we may never need to open this facility. And that would be an incredible victory for the people of Central Ohio. Whether or not we have to open the alternative care center depends on our residents' continued commitment to the health and well-being of the community. Each person throughout Central Ohio has a role every day to stay at home and practice social distancing, which can continue the great slowdown of the spread that we've seen in Central Ohio and across the state. Each and every one of us have a role to play in that, not just to protect ourselves and our families, but our neighbors that are on the front lines, those healthcare workers, those nurses, our public health employees, police officers, firefighters. We have an obligation to them as well. It's now my pleasure to introduce Dr. Mashika Roberts, our leader of our public health work here in Columbus. Dr. Roberts.
Thank you. Thank you so much, Mayor Gensler, and thank you, Commissioner O'Grady, for having me join you today, as well as for your ongoing support on this important public health crisis. As the mayor said, we have gotten some good indications that we are beginning to flatten the curve here in Ohio, as well as right here in the Columbus and Central Ohio area. But we do continue to see daily increases of our COVID-19 cases. So let me just give you some background information so that we're all on the same page of what we're seeing here locally. As of yesterday afternoon here in Columbus, we had 714 cases of COVID-19, and unfortunately we had 8 deaths. While older people, as we continue to say, are more susceptible to the complications of COVID-19, our largest group of confirmed cases of COVID-19 here in Columbus and Central Ohio are those between the ages of 20 and 29 years of age. To this group, I really want to remind you that you need to stay at home as well. By you staying at home, you are protecting others who are vulnerable, whether that be a young child, whether that be someone with a compromised immune system, or an older adult. So I encourage you to stay home, and if you have someone in your life that's in between those ages of 20 and 29 years of age, I encourage you to remind them they should stay at home as well. Additionally, 24% of our cases here locally are among healthcare professionals. Again, these are individuals on the front lines doing brave work every day to protect us, and unfortunately, they are getting infected as well. Another reason why individuals should stay home when they can. And unfortunately, healthcare disparities exist in all areas of health, and COVID-19 is no exception to that. Locally, 38% of our COVID-19 cases 39% of our hospitalized cases are African Americans. Keeping in mind that African Americans represent about 29% of the population in Columbus and 29% of our cases of COVID-19. So African Americans are disproportionately impacted by hospitalization. And we understand some of that has to do with they're more vulnerable. Many African Americans have chronic conditions, whether it be diabetes, heart disease, or lung disease, that puts them at increased risk of complications of COVID-19, thus requiring hospitalization. The rising number of cases, as well as the complications among our most vulnerable residents, enforces the importance of this alternate care center, which stands ready to accept and treat COVID-19 patients right here in our community if needed. We've seen the unfortunate consequences in other cities who are ahead of us in terms of cases and in terms of the negative impacts it's had on their community. And they've struggled to find overflow locations for their patients with COVID-19. That will not be the case here in Columbus. We stand ready, we are prepared. And as the mayor said, we're hoping that we don't have to use it, but I'd rather be ready and prepared than scramble to find a solution. We are so fortunate that we live in a city with 4 hospital systems, 3 of them being adult systems, that are willing and able to work closely together to solve some complicated community problems like COVID-19 in this pandemic. They're working together and contributing the best of their systems to make sure we are ready for the first patient should it be needed in our alternate care center here in Columbus. The alternate care center is a testament to the commitment we all share to protect the health of our community, no matter what it takes, during this unprecedented pandemic. I am so proud to work with all of them and all of you to protect the health and safety of all residents in our community. And thanks again for having me this afternoon, or this morning. Thanks.
Thank you. Next, we'll go to Dr. Robert Falcone. Dr. Falcone?
Thank you, Mayor. I am CEO of the Central Ohio Trauma System. Today, we announced that the Greater Columbus Convention Center is ready, as you've heard from everyone else. The 3 adult hospital systems in Columbus, Mount Carmel, Ohio Health, and Ohio State, have come together to collaboratively operate this facility. At this point, Nationwide Children's Hospital does not feel it will need Surge 3, but space is available if things change. While this convention center is a specific response to COVID-19, it is important for the citizens of our region to know this is not the first time that our hospitals have come together for the public good. COTS leads the coordinated healthcare planning for all emergency situations in our community, including pandemics. All of COTS partners, hospitals, public health, physicians, nurses, and other healthcare professionals, EMS, fire, police, and others have planned, designed processes, identified equipment, and conducted training exercise for years. We began planning for potential pandemics over a decade ago. Our pandemic plan was updated in January when we realized COVID-19 may be an issue for us here. The hospitals basically have 3 levels of preparedness. The first is level 3, and all our hospitals went into this stage of preparedness in early March. This is where the hospital stops doing elective procedures and discharges all those patients who don't absolutely need hospital care. This has led us to about 2,000 inpatient beds that are currently open and waiting for COVID patients, and about a third that many critical care beds. So at this point, we are in very good shape. If we exceed this capacity, our hospitals are ready to go to level 2. This is where they take non-inpatient space and convert it to inpatient use. For example, recovery rooms, endoscopy suites, waiting areas, and so forth. This will add another couple thousand beds to our ability to care for patients if we go to it. Finally, if we exceed this capacity, level 3 surge will be stood up at the convention center. This facility will operate more like a field hospital than a typical hospital you might be used to. It will be used for COVID-19 patients who are not sick enough to require full hospital care, but are not well enough to go home. They will come directly from one of our Columbus hospitals after a period of evaluation. We hope we will not need to open this facility, but it is ready. There are many partners to thank for making this a reality, especially our hospital systems, Ohio Health, Ohio State, Mount Carmel, Nationwide Children's Hospital, the State of Ohio and Ohio National Guard, Franklin County Commissioners, City of Columbus, State, County, and City Public Health, the Ohio EMA, and a huge thanks to Don Brown and the Greater Columbus Convention Center staff. Again, we went from concept to hospital in 2 weeks. I think that's an amazing tribute to our ability to collaborate for the public good. I'm going to stop there and introduce Brian Jepson. He's the president of Ohio Health Central Ohio Hospitals and the lead administrator for the Greater Columbus Convention Center Alternative Care Site. Brian?
Thank you, Dr. Falcone. I too would like to start by just acknowledging the leadership and the collaboration that it's taken to accomplish this feat over such a short period of time. We've been able to stand up a 1,000-bed alternative care site here in Columbus for our residents if needed, and it took a tremendous effort to be able to do that in such a short period of time. To give you some details about the facility and its capabilities, essentially it's the 3 adult hospital systems have their own space within the facility. We are sharing certain components for efficiency purposes, things like food service, waste disposal. There will be critical care beds in the facility, 6 of them that will be shared. We will not be providing long-term critical care at the facility. If a patient's condition were to deteriorate, we would stabilize them and then transfer them back to one of the hospitals. Before we have a 72, we're watching this very closely, what's happening in our community. Our transfer centers at all 3 of the adult healthcare systems are working very closely together. If we see that we're going to need the alternative site of care, we will activate it. That's a 72-hour process where we would then mobilize our staff at the site, as well as move in our supplies and prepare to start taking patients. There's been a tremendous commitment from all 3 healthcare systems to work together and to try to maximize our capacity within our existing hospitals before we would transfer a patient to the alternative care site. The space in the convention center, it's about 400,000 square feet of space. It's been converted to about approximately 1,000 beds. Each space is about 10 by 10 and is fully equipped like a medical room would be in one of our hospitals. As Dr. Falcone mentioned, we would only be transferring their patients that were recovering from COVID-19. All patients would be transferred from one of our hospitals, so their care would begin at one of our hospitals and then they would be transferred there. we would not be accepting direct admissions to the alternative site of care. And then patients, when they were ready to go home, they would be discharged directly from the alternative site of care to home. And so that's how it would work if we needed to activate it. I think now what we would like to do is open it up for any questions.
Thank you to all of our speakers. I want to let the media who's on the line know that in addition to Commissioner John O'Grady, Mayor Gensler, Dr. Roberts, Dr. Falcone, and Brian Jepson, we also have Jeff Young from Franklin County EMA, Don Brown from the Franklin County Convention Facilities Authority, Joe Mazzola from Franklin County Public Health, Lieutenant Colonel Buchanan from the National Guard, Jeff Klingler from the Central Ohio Hospital Council, Sherry Kovach, also from the Central Ohio Trauma System, and Malcolm Porter from the Central Ohio Trauma System. To our media, you should all have the ability to raise your hand and ask questions. That is down where you're logged on. If you click on that, it'll pop up and we'll be able to answer your questions. So, Cole Behrens, I see you have a question. Cole?
Yeah, I guess I'm the only media person in the, if I'm looking at it correctly. But so my first question is for Brian Jepson. What measures are being taken to standardize the care at the facility with 3 different hospitals operating within it?
That's a great question. So what we did is we had multidisciplinary teams from each of the 3 adult healthcare systems that have been meeting over the past several weeks, even prior to us starting to outfit the convention center on how we would deliver care. So similar staffing models, identifying what services we needed to share and what services we needed to provide separately. All 3 systems have their own electronic medical records, so IT was something that we needed to provide for our own electronic medical records platforms, those sorts of things. But there was a tremendous amount of collaboration and creating those teams, and it's been great to see how well everybody's worked together. And I think that, it's safe to say too, we all have the patient's best interest as our top priority. So that really was kind of our guiding principle around all this work.
Thank you, Brian. Carrie Ghosh from Business First.
Hey there.
Hi.
Can you hear me now?
We can hear you.
All right. Based on the latest guidance that you have from OSU and the state, when are you anticipating the surge, at least in Central Ohio? And do you have a sense of the size of that surge? And separate question for Dr. Roberts is, based on those numbers of the 20 to 29, have you seen the parties around campus and also these crowds of protesters that have been very not distanced around the State House the days? And what would you say to them about, their understanding of, well, social distancing that's keeping the curve down, or they think it's all fake?
Brian, do you want to answer the first part of the question?
What did Robin say? Robin, do you want me to take that?
Oh, sure, go ahead.
Sure. So, Carrie, thanks for the question. You broke up a little bit, but I think your question is, when are we expecting the surge here locally based on ODH models as well as our own modeling? And we've been looking at multiple models. So ODH does have a model. The hospital systems have been looking at their own modeling as well as public health. And based on that data, consistently, we're all expecting a surge to happen based on those models alone in the next 2 weeks. But as you've heard, right now, we're not seeing any surge at our hospitals, and we're hoping to keep it that way. And we're hoping with the social distancing that is taking place and will continue to take place, that we will successfully flatten the curve and not see that surge. That being said, all of our hospitals are prepared, and this alternate care center is prepared if that were to come, if a surge does come to fruition. Your second question, I believe, was about the age of our cases being 20 to 29, and I think you were trying to see if there was a connection between some of the parties going on near OSU's campus and that age group. I think it's a few factors that contribute to that age group. First, I think that age group feels that they're invincible and they can do anything and they won't be impacted by this infection or this pandemic. That's clearly not the case in what we're seeing in terms of our age of our cases. I do think what we're seeing and hearing about some of the socialization that's happening on off-campus properties by the university could be playing a role in this, but I think there's a number of other factors as well that are playing a role in this, that just that age group is not practicing some of the prevention messages that we're advising them, whether it's washing your hands, staying at home, avoiding other people. I think all of that plays into the numbers that we're seeing here locally for our cases.
Thank you for that answer. I want to remind our media friends, if you have questions, you should be able to see a hand icon next to your name. If you click on that, that'll raise it. That gives us the indication that you have a question to ask. Right now, we don't have any other questions, so I want to make sure we're getting everything we need. Cole, do you have another question?
Yeah, this question is for Lieutenant Colonel Buchanan. First, Lieutenant Colonel, if you could just offer a comment on the work that the National Guard has done setting up the facility. And then my second question would be the Adjutant General's office yesterday at the State Controlling Board meeting. They said that they are now requesting less money for the construction of these facilities through the CARES Act than they previously anticipated needing to use. I was wondering if that had been a factor at all in this, or that was from a separate standpoint.
Yeah, I'll address the second part of that question first, and that I think that requesting less money is a testament to the leadership of the people that's on this call, from the governor to the mayor to Jeff Young at the county to the hospital systems. All across the board, it was just phenomenal leadership that pulled a project together in less than 2 weeks, well under the anticipated cost for this project. So to do it faster than planned and cheaper than planned almost never happens, and it definitely doesn't happen without leadership. So the first part of that is a testament to the leadership that pulled all this together and made this happen. So what you saw yesterday was the outcome of that the project went well, pulling it together, it got the results that were needed, and so less money was requested. And overall, Central Ohio has done such a great job that it has alleviated a lot of the pressure off of the rest of the state to be able to follow suit and follow the model that was created here in Central Ohio. So that addresses the second part of that question. Can you repeat the first part of it?
Oh, can you hear me now? The first question, or I guess it was just kind of asking if you could offer a comment about the work that the National Guard has done in building this facility.
Yeah, absolutely. Our role was to come in and support the county, the city, and the state government. So we've been in a support role to help provide our expertise. The good thing about the National Guard is we all have civilian careers that usually provide unique skill sets that help us blend our civilian skills, our military skills together to help where needed. So a lot of times our role was either advisory or support to help people to fix problems, address concerns, help with communication, and then just support where needed. The good thing is in Central Ohio, our role was very limited because the hospital systems and the rest of the leadership had just a phenomenal help from the start. And so it's really just been support and advisory here in Central Ohio with the
Last call for any other questions. Okay, Okay, if there's nothing else, I want to thank all of you for joining us. Thanks to all of our speakers. If you have any more questions, please don't hesitate to reach out to Tyler or myself, and we'll do our best to get them answered. Thank you all and have a great afternoon.